Hello everyone, healthcare professionals, public health professionals, data professionals, and anyone interested in the future of healthcare. Welcome to my YouTube channel. I am Dr. Cliff at the intersection between clinical medicine and data analytics. And in this series, we are going to be exploring what it truly means to build a data-driven hospital. This series is designed to be both educational and practical. We'll approach this as a complete data analytics project, applying a full pipeline from start to finish within a healthcare setting. We begin by developing a clear understanding of the hospital as a business system, structure, workflows, and key operational challenges. From there, we'll design a robust database architecture that accurately captures clinical and administrative data. Next, we'll focus on data collection and preparation, ensuring that the data is clean, structured, and ready for analysis. We will then focus on data analytics, where we are going to be extracting meaningful insights from data using appropriate analytical methods. Finally, these insights are going to be translated into informed decision-making and practical recommendations that support clinical care. Throughout this process, we'll be using a range of tools commonly applied in data analytics, including database management systems, programming languages, and data visualization platforms. By the end of this series, you will not only understand each stage of the data analytics pipeline, but also how to apply it effectively within a real-world healthcare context. Let's get started. Welcome to Northbridge Hospital. This is a hypothetical district-level healthcare facility which has been designed to simulate the structure, operations, and challenges of a real-world hospital environment. While it does not physically exist, it has been carefully modeled to reflect realistic clinical workflows, administrative systems, and the patient care processes. This makes it an ideal framework for studying how data analytics can be applied to improve healthcare delivery. Northbridge Hospital serves an estimated 200 to 600 patients per month, with a bed capacity ranging from 80 to 120 inpatient beds. It provides both primary and secondary healthcare services and acts as a referral center for smaller surrounding clinics. The hospital is therefore a critical point of care, handling both routine and complex medical cases across multiple specialties. The hospital operates with a multidisciplinary workforce of approximately 120 to 180 staff members. These include doctors responsible for diagnosis and treatment, nurses who provide continuous patient care, laboratory personnel who handle diagnostics, pharmacists managing medications, administrative staff overseeing operations, and support staff ensuring the smooth running of the facility. Each of these roles contributes significantly to both patient care and data generation within the hospital. Structurally, the hospital is organized into several key departments. These include the emergency department, the outpatient department, internal medicine, surgery, pediatrics, obstetrics and gynecology, laboratory services, imaging, pharmacy, and the intensive care unit. Each department performs specialized functions, but all are interconnected within the broader healthcare delivery system. Now, let us examine the patient workflow across these departments, and more importantly, the data generated at each stage. At the emergency department, patients typically present with acute or urgent conditions. This is often the first point of contact for critically ill patients. At this stage, essential data is collected, including patient demographics, presenting complaints, triage category, and vital signs such as the blood pressure, pulse, respiratory rate, and temperature. This data is crucial for prioritizing care and initiating immediate interventions. Patients who are stable may then proceed to the outpatient department where they undergo consultation. Here, clinicians collect detailed clinical information including the medical history, physical examination findings, and provisional diagnosis. This stage generates structured and unstructured clinical data that forms the basis for further investigation and management. If additional evaluation is required, patients are referred to the laboratory department. The laboratory generates critical diagnostic data, including hematology results, biochemical profiles, and microbiology findings. These results are essential for confirming diagnosis and guiding treatment decisions. Similarly, patients undergo radiological investigations such as X-rays and ultrasound scans. The resulting imaging reports and interpretations provide visual and diagnostic insights that complement laboratory findings. Following diagnosis, patients may proceed to the pharmacy where medications are dispensed. Data collected at this stage includes prescription details, drug types, dosages, frequency, and dispensing records. This information is important for tracking medication use and ensuring patient safety. Patients who require admission are transferred to inpatient departments. In the medical ward, patients with non-surgical conditions are managed. Continuous monitoring data is collected here, including daily vital signs, treatment plans, progress notes, and patient responses to therapy over time. In the surgical ward, patients undergoing operative procedures are managed. This department generates data such as pre-operative assessments, operative notes, anesthesia records, and post-operative monitoring details, all of which are critical for surgical outcomes and patient safety. Within the obstetrics and gynecology department, care is provided for maternal and reproductive health. Data collected includes antenatal records, labor and delivery details, and maternal outcomes, which are essential for monitoring both mother and child. In the pediatrics and neonatology, care is focused on children and newborns. Data generated includes growth parameters, immunization records, developmental milestones, and neonatal monitoring data, which are crucial for early life health tracking. Finally, the intensive care unit. Critically ill patients receive advanced care. The ICU is one of the most data-intensive environments, generating continuous, high-frequency data such as heart rate, oxygen saturation, blood pressure, ventilator settings, and other real-time physiologic parameters. This data is vital for immediate life-saving decisions. All these departments are highly interconnected, forming a continuous and dynamic patient care pathway. Data flows from one department to another, supporting diagnosis, treatment, and follow-up. However, without proper integration, this data often remains fragmented. This leads us to the clinical challenges faced by the hospital, which include delays in diagnosis, limited access to decision support tools, inadequate tracking of patient outcomes, and difficulty identifying high-risk patients early. As a result, patient care may not always be as timely or effective as it could be. From an administrative perspective, the hospital faces challenges such as inefficient workflow coordination, long patient waiting times, poor communication between departments, and suboptimal allocation of resources. The lack of reliable performance metrics makes it difficult for management to assess and improve efficiency. In terms of financial and operational challenges, the hospital experiences revenue leakage due to incomplete billing and documentation, inefficient inventory management leading to stock out or overstocking, and poor forecasting of resources such as staff, equipment, and medication. All these challenges highlight the underutilization of data. This is where data analytics become essential. By implementing a structured data analytics pipeline, the hospital can systematically collect, store, and analyze data across all departments. This enables the transformation of raw data into actionable insights. Data analytics can support clinicians with evidence-based decision-making, help administrators optimize workflows and resource allocation, and as well enable hospital management to forecast needs and improve planning. Ultimately, this allows the hospital to transition from reactive care to a more proactive, efficient, and patient-centered system. In conclusion, Northbridge Hospital serves as a realistic model of modern healthcare systems, rich in data but limited in its use. Through the application of data analytics, we can unlock the full potential of this data to improve clinical outcomes, operational efficiency, and overall healthcare delivery.